epigenetics plays a huge role in the genetics that we get from our parents, but it sounds like there's other things, whether that's diet, lifestyle, that we could be doing that is affecting our gut, which in turn will affect our nervous system.
There is bidirectional flow. So you have, for example, the vagus nerve, which actually comes out of the brainstem, specifically the medulla within the brainstem, and innervates the gut.
The fact too that you say at 40 years old, this is the time now to be proactive of starting to do these tests. Whereas before we would think 60, 70, 80 years old, that's when stuff starts to surface.
Which is why when you see people with Alzheimer's, they're often quite passive early on. So you're now asking them a question, they're turning to their partner to ask for help with the answers. It's like the light bulb is a little dimmed. And so when you treat people and they get better, they kind of wake up again. They're actually improving.
Hello, everyone, and welcome back to another episode of For Life, a wellness podcast by Life Seasons. I'm your host, Niki Wolf, and boy, do we have a special guest in store for you. Dr. Dale Bredesen earned his MD from Duke University Medical Center, served as chief resident in neurology at the University of California, San Francisco, before joining the Nobel laureate Stanley Prusner's laboratory at UC San Francisco. And as a NIH postdoctoral fellow, he held faculty positions at UCSF, UCLA, and the University of California, San Diego. Dr. Bredesen also directed the program on aging at the Birmingham Institute before joining the Buck Institute in 1998 as founding president and CEO. But truly, he is a remarkable leader in neurology in the prevention and treatment of Alzheimer's and dementia. Thank you so much for being here, Dr. Bredesen.
Great to talk to you, Niki.
Absolutely. Well, we have an episode laid out for you guys really exploring the brain to gut connection because you have devoted your lifetime to understanding the brain. And what I'd love to do is kind of pull in what's going on in the gut, what can we be doing with our gut to help support the prevention of these neurological concerns. What exactly is this brain to gut connection? And I know that there's a bidirectional pathway that goes back and forth. What's happening there?
Yeah, so there are a couple of things in that. First of all, there is bidirectional flow. So you have, for example, the vagus nerve, which actually comes out of the brainstem, specifically the medulla within the brainstem, and innervates the gut. You have, by the way, a whole second nervous system, which is part of the control of your gut motility, et cetera. So you've got directions coming both from the brainstem down to the gut and from the gut back to the brainstem. In addition, not only do you have this neuronal connection, but you also have hormonal interactions. So things like leptin and ghrelin and things like that are communicating a gut to brain. So they really are strikingly interactive. And if you look at what actually causes the cognitive decline that ultimately becomes Alzheimer's disease, it really fits with things going on in your gut. So for example, the three major players when we develop cognitive decline, and unfortunately, we see people even in their 40s and 50s who are developing very significant cognitive decline. And you can even sometimes pick up changes on PET scans in the 20s and 30s. So what we used to think of as an old person's disease is really a disease of earlier life and midlife that gets diagnosed much later, very much like type 2 diabetes, where you may get diagnosed when you're 55 or 60, but you really were beginning those changes in your glucose metabolism in your 20s and 30s and that sort of thing. So the three big players in Alzheimer's are energetics, support for the brain, blood flow, oxygenation, mitochondrial function, inflammation, any sorts of pathogens, that sort of thing, and then toxicity. And then the three moderate players are neurotransmitters, trophic activity, neurotrophins, things like BDNF and things like that, and then stress. And all of those are affected by your gut-brain interaction. So there's really a tremendous interaction. And by the way, you may have seen Parkinson's has been shown also to have a very important gut-brain relationship. So it's turning out that this is a huge player in whether or not we are keeping good cognition, good motor movement, and things like that.
Well, and I know epigenetics plays a huge role in the genetics that we get from our parents. But it sounds like there's other things, whether that's diet, lifestyle, that we could be doing that is affecting our gut, which in turn will affect our nervous system. What kinds of input might we be doing that's negatively impacting our gut, which in turn affects our brain and might lead to some of these diagnoses?
Yeah, so many things, and just even our daily life. But let's start with the fact that you mentioned genetics and epigenetics. So with the genetics, you're actually talking about the sequence of the DNA. That's what you're inheriting from your parents, one copy from your mother, one copy from your father. And so that's not going to change unless you have some damage. You get exposed to toxins that can actually, in just a few cells, change those. Otherwise, you're going to have your genetic code. But as you said, your epigenetics is really how it's read out. Which genes are expressed, which are produced, which are not produced, which are suppressed, which are expressed. And so it's a little bit like thinking about your computer hardware versus computer software. You can update your software all the time. The hardware is what you bought. So that's the same way with genetics and the software, more like epigenetics. Now, what changes so many things so that you can, for example, let's say you're going along and you're eating a poor diet. You change your gut microbiome. Now you've got a different set of species in your gut microbiome where you have trillions and trillions of bacterial species and viral species and parasitic species, all these different things, fungi, etc. Now you may end up getting damaged. So your gut, unfortunately, the gut wall is just a single cell thick. So you get damage and you literally release things. And as you're eating your food, instead of getting broken down and then appropriately taken up and used for nutrition, you can get fragments, bacterial fragments, food fragments that are not broken down yet, leaking through your gut, your now broken gut wall into your bloodstream. And this is called leaky gut. And what happens, of course, your body recognizes this as foreign. It's not the little broken down stuff that, okay, that's fine. That's nutrition. We're going to take care of that. We're going to use that. It sees these things and says, oh, wait a minute. Am I being infected with a bacterium? What's going on here? And so now you make a response to that. And this is the beginning of ongoing inflammation, which increases your risk for Alzheimer's and for Parkinson's. This is the beginning of autoimmunity. As you respond to this, you may make antibodies, for example, or what's called T-cell responses, which are cellular as opposed to the antibodies, where they're now saying, wait a minute, we're going after this thing, but here's something that looks a lot like it. And it may be that you get multiple sclerosis. It may be that you get rheumatoid arthritis, lupus. These are all autoimmune diseases. So you can see that there's a tremendous interaction here where you want to keep your gut supported. You want to keep that gut to blood barrier nicely closed. And you want to make sure that you have appropriate interactions, both neuronally and hormonally.
I like that you mentioned that analogy of the hardware and the software because to your point, and I'm not an expert at this, but you are, that there could be some genetic indicators that we have that switch. It just hasn't been turned on. For instance, my mom, she found out recently celiac disease and then the switch turned on for lupus. So that was always in her from my understanding, but something triggered that switch. So it's one, becoming aware, is that in our genetic makeup, but then also what can we do to help prevent that switch? And from what I'm understanding is how do we reduce the chances of leaky gut, this permeability that we don't have these barriers in the wall? I know, in other episodes I've talked about, different foods that you can be eating or foods that you can be avoiding to make sure that we don't have that leaky gut. To your point, I didn't realize it was only a single cell barrier.
Yeah, that's the tough part. So it's just like anything else where, if you get gingivitis and you actually get, when you brush your teeth, you get blood, that means there is some connection with your blood. And the same thing happens in your gut. There's this very thin barrier, a single cell thick, between what's being digested and what's being taken up into your bloodstream for nutrition. When everything goes well, it's great. You've got the bacteria there. They're happy. They actually help make the mucus that keeps that nice and closed. They're making your nice postbiotics. They're making things that are good for you. A lot of your neurotransmitters are coming from your gut. All these things are working great. When you start to break that down, now you've got all sorts of problems with leaking, with now immunological activation. You're getting these things into your bloodstream, et cetera. So things really fall apart, unfortunately. The good news is gut health is something that we understand much better than we did 10 years ago. And there is so much you can do about it. Let's go from A to Z here. So let's start with prebiotics. And so prebiotic fiber, and you want both the soluble and the insoluble fiber. The insoluble is like a lattice work. It's got like fingers in it. And then the soluble is like putty. So it's like bricks and putty almost. And that you
I
put
was just
thinking
thinking that.
Really nice. Really nice thing to do. So, prebiotic fiber. Now you can get that from things like lettuce. You can get it from supplements. And I know you've got a supplement that you use that works very effectively. And maybe you could mention that.
Absolutely. Regularity by Life Seasons. It has that psyllium. It has some other forms of supporting ingredients. It's going to be good for stool support. But to your point, it's going to have that added fiber, that insoluble fiber that's going to be more of that netting.
Yeah. And so, psyllium husk is a good one. People use inulin, all these sorts of things. So this is essentially food for the microbiome. Then the second piece is the probiotics. That's the microbiome itself. So it's like the first one's fish food, the second one's the fish. So you want to have, and there's multiple different species that all work together, interestingly, to optimize your gut. And then the third thing is postbiotics. These are the things that the bacteria are actually making. And there are many of these things, as I mentioned, neurotransmitters, but a couple of noteworthy ones. One of them is urolithin A. One of them is butyrate. So I like to take, for example, probutyrate. Urolithin is one that a lot of people really like now because it is one that's very supportive of the mitochondria, helpful in energetics. So these things all work together. Now, you mentioned, how do you heal it? And it's a really important point because many of the people we see with cognitive decline have a leaky gut. And so what we want to start by doing is using bone broth or using other things that heal. Slippery elm is another good one. There are a number of ways to do this. Probutyrate itself, one of the postbiotics, actually supports and helps to heal that gut. So you want to heal it, and you can actually test for this to make sure that your gut has healed up, because it does make a huge difference. As long as you are triggering ongoing systemic inflammation, you're at increased risk for cognitive decline. You're going to be at increased risk for Parkinson's. You're going to be at increased risk for cardiovascular disease, all of these things. So that's why we really want to keep that gut happy and functioning well, and basically talking to your brain back and forth in a very effective and positive way. You want them to have good conversations back and forth, not bad conversations back and forth.
Absolutely. I've heard the analogy of like the vagus nerve as a highway. And so we don't want a traffic build up. We want things to move slowly. And I like how the pre, pro, and post, and I think, we've heard post, probiotics. Postbiotics is starting to become much more recognized, and the benefits behind it. Would you, using your fish analogy of the fish food, the fish, would the postbiotics technically be the poop? Because I'm sure that I know we're not necessarily talking fish, but there has to be benefits behind what it produces and how it provides benefits to the body as whole.
Yeah, so I wouldn't say so much the excrement, because we think of that as what's good in that. It's really more about what fish are doing. For example, it's building a nest, or it's the fact that, how the little cleaner fish will go and clean the bigger fish, will actually take some of the things. So they actually enhance their environment by doing a cleaning thing. So in this case, you've got these postbiotics made by your bacteria, which are very supportive for your body function. So we're kind of interdependent. They're depending on you to feed them with the prebiotics, and you're depending on them. We're depending on them to feed us. with things like urolithin and butyrate and a number of other things, neurotransmitters and things like this that are all coming from the interaction of these things and their normal work. So you're really depending on them to do their normal jobs.
Absolutely. And I know we have our clinical immunity quick start that's going to have those postbiotics from Epicor. There's prebiotics, probiotics, all inclusive in there. But like to your point of eating a fiber rich diet is going to help produce those short chain fatty acids that are going to support our gut health. Now, coming back to our specific connection with Alzheimer's and dementia, how is it specifically, how is the gut-brain axis contributing to the development and that progression of Alzheimer's?
Yeah, great point. And, there are numerous ways, and it's not completely understood yet. One of the ideas here is that you're actually making these prions, which are little, essentially small fragments of protein that beget more of themselves. So in some ways, you can think of them like infectious agents, even though they're not bacteria, they're not viruses, they are prions. And so these things can actually move along the vagus nerve. And so you're literally going from the gut ultimately up to the brainstem. And this looks like this happens both in Parkinson's and Alzheimer's. And interestingly, in Parkinson's, you see early pathology in the brainstem with a specific molecule called alpha-synuclein, which is an antibacterial. It's the body's attempt to fight this insult of these various bacteria. And that is in the midbrain, which is an area called the substantia nigra pars compacta. That's an area of neuroanatomy that goes first in Parkinson's. Interestingly, not far away from that, down in the pons is the locus ceruleus, another part of your brainstem, again, which connects your vagus is right near there. And the locus ceruleus is the area that starts Alzheimer's disease. This is the area that projects its fibers up to your cortex, up to your entire brain. And that is important for norepinephrine. So literally for keeping you awake and going, which is why when you see people with Alzheimer's, they're often quite passive early on. So you're now asking them a question. They're turning to their partner to ask for help with the answers. It's like the light bulb is a little dimmed. And so when you treat people and they get better, they kind of wake up again. They're actually improving. So you do have this connectivity, which seems to be something that you even have these proteins that move along there. Then you've got the less direct routes, as I mentioned earlier, of the leakage and the inflammation. What happens, and unfortunately, this is both true for COVID and for Alzheimer's, which is why we're so concerned that these repeated COVID outbreaks may increase the risk for Alzheimer's in the future. And there's already some evidence that people who do get COVID are at increased risk for Alzheimer's, which is, again, why we should all be getting a cognoscopy. We should all be finding out what our current status is and get on active prevention or earliest treatment. If you have any symptoms, please don't wait because this can sneak up on you. But what happens is, you've got your innate immune system, which is the early warning system. That's the thing that says something's gone wrong. We got to really be careful, but it doesn't tell you what it is yet. Then what happens, that hands off to the adaptive system, which is the more specific one. And that one's saying, Niki, okay, we know what it is. This is COVID, or this is pneumococcus, or this is another bacterium or a fungus. Then it goes specifically at that. So you've got the non-specific but early warning part, and then you got the specific part that takes up. Now what happens in Alzheimer's, you have continued activation of the innate system. So you've got ongoing inflammation, but you don't have enough of the adaptive to clear it. The same thing happens when you get COVID, where you're not clearing the COVID, sometimes because you're just overwhelmed with so much of the virus. But for whatever reason, you're not clearing that. So what happens, unfortunately, for people who are overwhelmed with COVID, as you know, they die from cytokine storm. In Alzheimer's disease, it's cytokine drizzle. So it's just a slow, long production of this ongoing inflammation with cytokines and things like that. So what we want to do is we want to support that. We want to get that adaptive immune system to clean things out, to clear these things, which means reducing the exposure, which means identifying what's actually causing it. We see people all the time who have undiagnosed chronic mild infections. They can be from a tick-borne illness. They can be from various mold species and things like that, who continue their cognitive decline until you identify those and treat them. So
let me
go ahead.
I just want to clarify to make sure I'm absorbing this correct, that there's the two immune system. There's that innate, and then there's the more specific adaptive one. Yes. And is this adapted? Is this true that, because it gave so much powerful information, that the innate will then signal the adaptive and kind of it yes. goes from there. But one thing that I remember years ago talking with you, and why you've been so profound in the prevention and reversal of Alzheimer's and dementia is we're constantly suppressing. We're never really getting to the root. So if somebody falls, trips, and they get a cut, we're looking at how do we remove the Band-Aid? We're not looking at how do we prevent tripping. It is what is happening. We're just submissing the innate and not allowing our body to go to that specific. Does that make sense? Or am I understanding that properly?
Yeah, no, that's correct. So what happens is you get, the idea of inflammation, we're all taught, inflammation bad. Well, yes, over the long haul, but inflammation has a normal role. Just as you said, if you cut yourself, you have a short period of inflammation, you heal the wound, everything's good again. And so when you get exposed to these various insults, COVID-19 is one of them, but many different infections, toxins, things like that, you have this response. But normally when everything goes right, you have a short-term innate response. And now what happens is the adaptive gets activated so that it says, aha, now we know what the problem is. The adaptive, one of its jobs is to turn down the innate. But if you have continued exposure, it just keeps going. You never get that chance. So you have this chronic ongoing inflammation. So when you take anti-inflammatories, when you take things like omega-3s, or you're getting your pregnenolone optimized, or you're taking some curcumin, these are all wonderful anti-inflammatories. But please don't forget, it's in the long run, you want to get rid of what's causing this to begin with. And that is commonly a leaky gut or exposure to various bacteria, fungi, things like that. So you have to kind of take it together. As you said, get rid of the things upstream. If you're hitting your head on the wall every day, don't just put a Band-Aid on there. Stop hitting your head on the wall as well. You're going to do so much better in the long run. And the same thing is true for these. And yet you hear this all the time. People say, well, I'm taking all these anti-inflammatories, but I really don't know what's causing the inflammation. Well, let's find out what's causing that, and let's get rid of that so that you can really reset things and do better and better and better. That's the long-term solution.
Yep, to get to the root cause of what's creating it in the first place. So I know you've dedicated a lot of your work into creating this Bredesen 7 protocol. So it's the top 7 strategies, ways that we can help prevent the decline of cognitive health. And I know you and I have explored, sleep, supplements.
Yes.
What are some of these other factors that we can start implementing to support our leaky gut, to support this gut microbiome? I know we've, discussed a number of these, but are there any other sort of lifestyle factors that would be helpful?
Absolutely. And so when you look at people who have cognitive decline, and until we get the first reversals of cognitive decline in history, published back in 2014, and we've continued. We've got another trial ongoing now. Until then, people just said, we don't know where this came from. We're going to give you a medicine, but you're not going to get better. And that's been a huge problem. Now, what you found is, as I mentioned earlier, you've got these things. You can identify what are the energetic contributors, what are the inflammatory contributors, what are the toxic contributors. So when we then treat that, we translate that into, okay, how do we make people better? Then what happens, as you said, there are the 7 basics, and then there are the specifics. So what you want to do is start with the 7 basics, and then you can work with your practitioner to help you to determine, are there specific infections? Are there specific toxins that have been missed? Things like that. So the 7 basics are diet, exercise, sleep, stress, brain training, detox, and some targeted supplements. So there are specific things you can do, again, to improve that ratio, because when you come right down to it, what cognitive decline is all about is an insufficiency of supporting your network. You have this remarkable network of about 500 trillion connections in your brain, and you don't have enough to support it, either because you've got reduced blood flow, you've got reduced mitochondrial function, reduced oxygenation, which is why sleep apnea is an important contributor, or because you've increased your demand because of inflammation, because of toxins. That's increasing the demand. So what we want to do when we treat people is improve the supply and reduce the demand. Get rid of those toxins, get rid of those various inflammatory agents, the various microbes, and bring that up, better blood flow, et cetera. So when we talk about diet, we are talking about a plant-rich, mildly ketogenic diet, which has worked very well for so many people. We call it KetoFlex 12-3. You can actually get this delivered to your home now, so it's easy to do. Exercise. We really like things like EWOT, exercise with oxygen therapy, simply because it improves not only blood flow, but oxygenation as well. But both strength training and aerobic exercise. HIIT is another good example. Some people like to use Katsu bands because they essentially give you more bang for your buck. These are just restriction bands that slow down the blood flow a little bit. So now you're actually kind of getting more, for whatever you do, you're actually getting more improvement with that. Sleep, you could spend hours talking about sleep. I check my own every day on a wearable. And so you want to get at least 7 hours of sleep, at least 1 hour of deep sleep, at least 1.5 hours of REM sleep. And you want to keep your oxygenation preferably up at the 96 to 98. But as long as it's staying above 92, you're in good shape. I worry about people when they're getting down into the 80s, and we have people even getting down into the 70s. That is just not enough oxygen saturation for your brain. And it is unquestionably a contributor in many people to cognitive decline. So try to keep it, up in the above 92% oxygen saturation while you're sleeping. You may want to get a sleep study if that's not what you're seeing. And then stress. It's a huge issue. Interestingly, what stress does, when you have ongoing stress, it resets your innate system. So there's innate system actually has a memory, just as the adaptive system has a memory for what you've been exposed to. And the innate system sets depending on, is it expecting you to be exposed to a lot of things, or is it in a relaxed state? So for example, when you take things like omega-3s, it helps to relax that. And it says, okay, things are good. You're not at high risk. But if you are under stress, you are amped up, ready. Oh my gosh, that says I am at high risk for having exposure to things that are going to be a problem, where I'm going to have to fight them with my immune system. So the setting is high. And by the way, things like saturated fats, boom, set it up high. Adverse childhood experiences, boom, set it up high. ApoE4, boom, sets it up high. All of these things, therefore, are increasing your risk for this long-term inflammation and increased risk for cognitive decline. So that's why so important to get that stress down. Some people like to use, biofeedback. Some people like to use heart math, meditation, so-called forest bathing, Shinrin Yoku, soft music, whatever you like to do. Is really helpful. And again, as a scientist, I used to think these things were unimportant. Like come on, it's just about stress. It turns out I can't deny the data. It's very clear that things like meditation improve your neuroplasticity, improve your blood pressure, improve your relaxation, improve your cortisol level. So it's very striking what these things have done. So then the other three are brain training, no question, that's helpful. And there's some nice published studies on things like double decision, which is one of the programs that you can use that clearly reduce your risk for Alzheimer's, somewhat surprisingly, and something that's really excellent. And then, as I mentioned, things like also having detox and some basic detox helpful for all of us. Unfortunately, we live in a world where we all have some toxic exposure. Here, we have, the California fires, no question. Air pollution has been shown very clearly to increase risk for cognitive decline. The mercury that you get exposed to in high levels of things like mercury in tuna fish, that can increase risk. So all these things are very important. And then the targeted supplements, and obviously you know a lot about this. So and this is why things like NeuroQ have been so helpful. A nice combination where you're essentially addressing each of the things that we found in the lab are important for cognitive decline. So you have the ability now to have an anti-inflammatory effect, to resolve your inflammation from your omegas that you can take with that. You've got curcumin in there, things like that. You've got whole coffee fruit extract that increases BDNF. So that's now increasing your neurotrophic support. So all sorts of good things. And so taking targeted ones. If you're low in vitamin D, make sure to take some vitamin D. If you're low in B12, which we see a lot, make sure to get some B12. If your homocysteine is too high, then you can bring that down easily with a combination of methyl B12, methylfolate, and P5P, which is pyridoxal 5-phosphate, which is one of the B6. It's essentially an active form of B6. So the great news is that, when I was training years and years ago, I was always told, the armamentarium is zero. There's nothing we can do about this cognitive change. If someone has Alzheimer's, it's over. Now we know that the armamentarium is huge. We understand this disease like never before. And we understand that many of us are in the earliest stages. They're not going to diagnose you for Alzheimer's until much later. In fact, there was a really interesting study that just came out of China just recently, where they followed people for years and they looked at when the diagnosis of Alzheimer's actually occurred. And then they looked at what happened before that. And they could see changes 18 years before this that could be picked up. Now there are these wonderful new blood tests, such as p-tau217. That particular one is offered by Neurocode. So really nice in that you can look early on and see, am I ahead of this? It's just like type 2 diabetes. You can look early on and say, I don't ever want to get diabetes. Let's check early and I can head it off and make sure I never get type 2 diabetes. The same thing is now true for Alzheimer's. You can look very early, essentially pre-Alzheimer's, and make sure that you never have the problem. And so we encourage everyone who's 40 years of age or over, please get a cognoscopy. You can go to mycognoscopy.com, get the blood test. You can go to getabrainscan.com. BrainScan is a combination of 3 of these blood tests. Check it out. Make sure that you don't ever have to worry about cognitive decline. And the reality is we are making Alzheimer's optional for the first time so that you don't have to wait. You don't have to have these problems. So it's major changes in the last few years.
Oh, significant. I mean, the fact too that you say at 40 years old, this is the time now to be proactive of starting to do these tests. Whereas before we would think 60, 70, 80 years old, that's when stuff starts to surface. But to your point, I mean, even quite a few minutes ago when you talked about if you're in a conversation with somebody and somebody asks you a question, but you pass it off to your partner, that's a really good indicator that let's start working preventatively to ensure that this is an optional disease. This isn't something that's just going to be handed to me. What can we start implementing? What kind of preventative measures can we start to take? And you laid it out, these 7 different approaches on how we can implement these into our lives. And some of them, are very approachable things that we can be doing. I mean, focusing on sleep. One thing too, I'd be curious, there was a few different things. Detoxifying. I mean, you could be intentional. I'm not using plastic. I'm staying away from BPAs. But if you have these genetic codes, MTHFR mutation, you got to take it a step further and ensure that you're doing everything you can to eliminate. But you mentioned one thing in particular that could be a little bit controversial. And I'd love to know your point. Because the data proves itself. You mentioned saturated fats can lead to the inflammation. I know right now in these past few years, saturated fats are this big boom. It's like, let's fill our bodies and consume all this saturated fat. what does the research show in regards to the connection between saturated fat and its connection to cognitive decline?
Great point. And you're right. And it's, you have to remember that there are many of these things that they all work together. So it's not black and white. It's not this good, this bad. For example, like people say, well, eating fish, good or bad? Well, it depends on what kind of fish. Is it wild caught? Is it high mercury, low mercury? All those sorts of things. But let me just give a little background on this. Just talked to a guy 2 days ago, doing well. He's thinking everything is great. He's now, he's 70, and said, occasionally I do have a little trouble with finding a word. And his family said, occasionally there's something not quite perfect. So I was like, well, okay, let me just get checked out. He was well into MCI. He already was scoring 23 out of 30 on the MoCA score, which is already significant. This is the third of 4 stages when you're getting Alzheimer's. So a great example where he's very functional, but when he really asks himself, something's not quite right, has an amyloid scan of his brain. He has Alzheimer's. So the good news is he's relatively early. I told him, look, don't worry. We have reversed cognitive decline in many, now thousands of people. The tough time is when you wait till really late. Now, how does this lead into saturated fats? So again, it's your risk. It's what's accumulating over time. The good news is if it hasn't accumulated too much, you can do very well. Now, no question, saturated fats are wonderful for energetics. Some people like to take MCT oil or coconut oil. Make sure to follow your lipid panel, though, because in some people, it'll bring your lipid panel up, which is why for those people, we say, okay, just use ketone salts or esters to bring your ketone levels up. Don't worry about the MCT oil or the coconut oil. In others, it won't bother them at all. Now, you're right. We get in our food, we get saturated and unsaturated fats. In general, we prefer the monounsaturates and polyunsaturates, things like extra virgin olive oil, things like avocado oil, and things like that. But again, as long as everything is okay with your lipid profile, it is fine. Now, when you have things like butter and things like meats, and again, we want to use, you want to have pastured chicken if you're going to have chicken. You want to have grass-fed beef if you're going to have beef, because these have a better health profile for your lipids. So these will give you some of the saturated fats, but it will also give you some of the good fats. Avocado, another great one for good fats, these sorts of things. So combining them, you should be fine. But you're right. There are people that have a bad combination, lots of saturated fats, high omega-6 to omega-3 ratio. Omega-6 is the more inflammatory. Omega-3 is the more anti-inflammatory. You should be at a ratio of anywhere like the 6 to 3 of 1 to 1 to 4 to 1. The average American diet is about 15 to 1. So you're having
and that's
all this,
the omega-6 being the 15 and the omega-3 being
exactly.
the 1.
So you've got the pro-inflammatory here and the anti-inflammatory here, and that's a problem. And so then you combine that with not much fiber in your diet. That's another problem, because the fiber actually lowers problems with glucose and it lowers problems with lipids. It's actually very, very helpful. And then you combine that with too much simple carbohydrate. That is a very, very damaging combination. And by the way, one of the ways that you can give yourself cognitive decline over time. So this is why you want to be careful about too much saturated fats. And as I mentioned earlier, it also will set your innate immune system on a set point of being very sensitive and giving you quick inflammation.
Great. Thank you for clarifying that. I appreciate that. I mean, I feel like we've covered quite a bit, not just, things to, I think the underlying thing is becoming your own advocate and becoming aware, because the gentleman that you just discussed, he came in, he recognized that there was something going on. He became aware and conscious enough that something seems a little bit off. I think that is the underlying tone of, let's work preventatively so that we don't have to do these, extreme treatments or whatever that looks like. Let's find what's going on at its early stage, because there's such a higher success rate to make sure that we can reverse these, not just cognitive decline, but I think any sort of health concern.
So if you look at all these chronic illnesses, so 100 years ago, people were dying of infectious things like tuberculosis and things like that. Today, almost all of us, our health is compromised, and what will ultimately kill us are chronic diseases. It's Alzheimer's, it's Parkinson's, it's cancer, it's cardiovascular disease, it's chronic renal failure. These are the complex chronic illnesses that are hurting us today. Now, the good news on those is that you can see them coming. Long before you get symptoms, you can see it coming if you know what to look for, and you can actually make sure you never have significant problems. The bad news for these is once you start getting significant symptoms, it's relatively late in the process. You go for years without much in terms of symptoms. And then when you're developing the symptoms, that's relatively late, which is why we say to everyone, please get on active prevention, get evaluated. It's easy. You can go to mycognoscopy.com is one way to do it. It's like colonoscopy, but it's for your brain. It's easy to do. Or if you're getting the earliest symptoms, please don't wait. And for this particular guy, fortunately, his wife and his daughter said, something's just not quite right. He's like, well, I still can do a lot. Yeah, you can do a lot. But for you, something has changed. So it's that change that is really concerning. He was having trouble with specific words, for example. And after treatment, he'll do much better. We've seen it again and again and again. And the important thing is he'll never then progress to the point where he actually has to go into a nursing home. The problem is people wait and wait and wait, and this kind of sneaks up on you. And ultimately, they can't take care of themselves and they end up in a nursing home. So we don't ever want it to get anything close to that. We want to get prevention or earliest treatment.
Absolutely. And I'll make sure to leave in the show notes all these resources that you mentioned, the testing, the Bredesen protocol. I'll make sure to include that in there. But thank you so much for being here, Dr. Bredesen. You always provide a wealth of information that I think we all want to do some research after we finish this episode and just start to take a more proactive approach to our health.
Let's all keep improving our gut health. Great to talk to you, Niki, as always.
Same here. All right. Take care, Dr. Bredesen. Bye.
Bye-bye.